Hi everyone, welcome to Espina Chiropractic's Ask the Expert on Friday afternoon at 2 p.m. Today we're just going to answer some of the questions that have come in this week, and we've got all of our chiropractors online here. So each person has their, their areas of expertise and their interests. So I've tried to put your specific questions towards the right person that is best placed to answer those. And the first person that the question is targeted towards, I think is going to go to Tamsin. Question says, I am in my 4th month of pregnancy and recently noticed some tenderness at the front of my pelvis. It's particularly worse when walking up and down stairs. Is this just due to not moving as much as usual during lockdown? So Tamsin, if I can put that one to you, if that's all right.
Yeah, okay, thank you for that question. Well, tenderness at the front of your pelvis during pregnancy is sadly very common. It's often caused by a stiffness of the pelvic joints or the joints moving unevenly, either at the front or the back of your pelvis. And yet, of course, during this time of lockdown, it could be aggravated by not moving as much if you're not getting out and doing as much as you were previously. Just to give you a little bit of a background, as your pregnancy progresses, of course, your baby is growing in weight and your body is changing due to hormonal influences. And all of this increases your weight and changes your centre of gravity and how you move and how you use your body. Like I mentioned, there's also hormonal changes going on from the hormones relaxin and progesterone, and they make the ligaments supporting your pelvis more lax during pregnancy. Often it can be very painful. Some people describe it as a stabbing pain. It can typically be quite painful in the area when you are going up and down the stairs or walking, doing activities of daily living, such as getting dressed when you're standing on one leg, and turning over in bed can be quite painful, as well as getting up from a chair and moving your legs apart, for example, when you get out of a car. There are some exercises you can do to help the pain yourself. A couple that you can do which are very easy to do at home are to start to engage your pelvic floor muscles. So you can do this by imagining that you are stopping yourself passing urine, and then you're stopping yourself passing wind. And then you can pull in some more. And you can hold that for 5 seconds. Don't hold your breath, keep breathing while you're holding it, and then release it. And if you aim to do this 8 or 10 times and very regularly throughout the day, so you could find a time that's good for you to do during the day, for instance, when you're going to the loo. So if you're having a wee 8 or 10 times a day, do it while you're either sitting on the loo or while you're standing afterwards. You can also do it on all fours if you find that easier, but try to do that 8 to 10 times a day, which is going to help to stabilize your pelvis a little bit. If it's very painful while you're turning over in bed, you can try turning over in bed with your knees, and your hips together as though they're pinned together. And when you're turning from one side to the other, squeeze your buttocks together while you're turning, but try and keep them close together. That also might help. Avoid sitting or being in a position where you're opening your legs too wide. That will put a little bit of pressure on that joint and the muscles and ligaments that attach to it. So try and be kind to yourself and avoid that. Another exercise that can help strengthen those muscles is by just popping a cushion or a pillow in between your legs while you're sitting down, while you're lying down, and just squeezing your knees together. So all of these exercises are very gentle with minimal movement and trying to get a little bit of mobility but stability into that area that you're suffering pain with. Of course, we can see you over the telephone to assess properly what's happening and ask you some more detailed questions, and we can give you extra things to do when we know what we've found, and of course we can all see you face to face hopefully in the near future. I hope that helps.
Yeah, thank you ever so much. That's really useful, and that's a really good point that you raise there, Tanya. So we're in this position at the moment, as is the the whole country, in the fact that we're in this lockdown. But that doesn't mean that we're not here for people. We're still available on the telephone. We can do video telehealth consultations. And as our contribution to the community as well, we're doing those initial consultations completely complimentary, so that no one is left, out in the cold and hasn't got someone to turn to for advice with regards to their aches and pains at the moment. And then as soon as we are back up and running face to face, then we'll be able to see you as soon as possible. So, right then, let's look at another question. Thanks for that, Tanzania. I think that was excellent. So, Charlie, that comes on to you. So for those people that don't know, Charlie is our chiropractor in Reading, or just outside of Reading, and she is lucky enough to also treat, or we're lucky enough to have her treating animals as well. So she gets both ends of the stick. She gets animals and owners. And the first question that is going to Charlie is, it says, I've recently come back to horse riding after a 10-year break, and making every effort to continue this where I can at the moment. However, I have started to get some lower back pain and can't seem to find a comfortable length for my stirrups. If I just make them equal and persevere, will that sort everything out? So Charlie, over to you.
In a simple question, no, that won't sort it out. Pelvic imbalance significantly affects both horse and rider. I'll explain the reason why first, and then go into what you need to do with it. Is the reason why you don't want to shift it is the imbalance often shortens the hip flexors, deactivating your deep core muscles, which as a horse rider or horse riders know is incredibly important with riding. Because of this, you tend to get a bit more of a forward tilting pelvis in the saddle, which creates a bit of a weight imbalance. What you were saying about the stirrups, you get what I call the rider fidget. So you get into the saddle and you're twisting and shifting to try and get comfortable, changing your stirrups to try and get yourself in what's called a false position, which often leads to asymmetrical leg positioning and a crooked seat. You don't want this because long term it causes a horse to work in false engagement because of that imbalance coming from the rider. And this can lead to poor behaviour in the horses, resistance to work, difficulty in transitions, rearing, and this is simply because they are compensating against the rider's imbalance. So simple answer to whether you just change your stirrups and shift it accordingly is no. You want to try and get yourself to a point that you're more balanced on the horse. Obviously, ideally, I would get a rider in to assess them and see what their biomechanics are like, and often I compare that to how the horse is going because there's usually a correlation there. But whilst we're in the isolation state, I would recommend, if the lower back pain isn't of too much discomfort, carry on riding. The general movement and mobility of the riding will help the lower back. But maybe try riding without stirrups. That way you can sort of relax more into your sitting bones and start to feel yourself a bit more, and then you may just be able to self-balance in the saddle. Balance and core strength Pilates is proven very, very effective to horse riders, improves stamina, stability and suppleness. And whilst we're in isolation, it's a great mental relief as well. So it's just getting the strength there whilst you're getting back into the saddle, because you're starting to use muscles that you haven't used probably for years, and it's just about retraining the muscles whilst riding. So yes, that's it.
Thank you very much. I guess if someone's really concerned, they can still book an online appointment with you. And could they send you a video maybe of them riding?
Yeah, I quite often do online riding consults and have done in the past few weeks. It gives me an idea of how the horse and rider are working together and try and work out what it is that's actually causing the problems. So feel free to obviously contact me with any of those videos, and I can assess it from home and maybe build you a program depending on what I see and what's most important, really.
Great, thank you ever so much. That's amazing. So let's move on to another question. This is, I'm an 82-year-old and would consider myself relatively fit. There's no mention here whether male or female, so I can't help you there. But I'm an 82-year-old and would consider myself relatively fit. I previously went swimming 3 times a week and had an active social life. Apart from missing the interaction with everyone at the moment, I'm also starting to feel stiffer in my hips than I ever have. I'm pretty sure I have some arthritis, but is there anything I can do to ease the stiffness? I find it's worse in the morning. I'm going to put this one to Philippa, if that's okay. So Philippa is our chiropractor down in Bournemouth, and actually she sees quite a lot of people 60 upwards. So I think, yeah, if Philippa, if you don't mind answering this question.
Yeah, that'd be great. Thank you very much. So stiffness in the hips through lack of movement over time is quite common, and you're right, it could be an age-related problem, but the great news is, even with arthritis, we know that keeping moving is very good and helpful. And so finding ways to generally try and be a bit more active with the socialization. So if you could use your garden, or going up and down stairs more often, and even walking on the spot can be good. But I hear you with the social elements of that, and missing that interaction, and maybe an online class might be helpful and interesting for you too. You can get some gentle stretches. It can be a bit overwhelming on the internet if you can get access to that. But if you use NHS sites, then you know you're getting something sensible. But I'd always be happy to talk through something, and we can put a plan together over the phone, really, because we can send out some exercises electronically more specific to your concern. Trying to avoid sitting for long periods is sitting and standing for long periods can help as well. And as the pain is slightly worse in the morning, maybe just some gentle stretches first thing, just to get everything mobile and moving. Some self massage. So if you've got a tennis ball or something that's not too hard and not too soft, that can help. You can kind of sit on it so you can get the right pressure. Something that's a little uncomfortable but not too painful, because you don't want the resistance from the muscles there. So I think those kind of things are generally helpful. Tends to be nothing that you need to be overly concerned about, and that would generally settle things. But if you need some more support, then seeing face to face is probably ideal, because then we can get an assessment and something more specific for you. And my other point was, if you are, when you're going back out again, you're increasing your activity again, that would be something you need to do quite gradually, because you don't want to just think you can go from 0 to 60 and go straight back into things, because that might pose some issues, and we need to pace that. That would be my advice.
Yeah, thank you very much. I think that last point that you made is really important, because we do see that quite commonly, even when we're not in the situation that we're currently in, where you get this boom or bust situation where people just have a good day, even through their normal care whilst we're treating them. There'll be ups and downs along the journey. And yeah, you have a great day and you just go all out and you go for a run and you paint the house and you wash the car, and sometimes it's just a little bit too much too soon. So I thought that was a really important point that you made, just making sure that you pace yourself. But I think also we're all in the same position to some extent at the moment, aren't we? In that our activity levels are probably lower than ever. So it is really important to make sure with that hour a day that we have of exercise, that we do try and get out there and still get some fresh air and do some walking where we can, especially if you're able to and you're nice and fit usually. Great, thank you, Philippa. So next question, let's have a look. This one, I'm not sure if this is a patient of yours, Kate, but it was targeted at you. It says, my husband is in his late 60s and I keep telling him he needs to come to see you. He is always grumbling about his back being stiff and painful. It doesn't say low back or upper back. So I'm not sure here, but I promise I'll bring him in, see you when you're back seeing people face to face. But is there anything you can recommend he do at home for now?
Okay, so basically, obviously, as we are being self-isolated, and as it's been already said that we're not moving as much as we should be, obviously that lack of movement can obviously increase the strain upon the musculature, which then obviously increases the pain and discomfort which he could be feeling. The best thing to do really is to try and keep moving as much as able to, really make sure you're going out for that walk on that hour. To also maybe do some simple exercises as well, just like sort of like a knee to chest hug. That's really good for opening up and getting maneuverability throughout the whole of the spine there. And also simple stretches like the cat stretch, where you're on all fours and you sort of tuck your tailbone underneath and so arch the back up and drop the chin to the chest, and really bring the back up to the ceiling, and that will really open it up. And then you do the opposite with bringing your head up, chin up, and sort of dipping in the back there nice and gently. Again, that will open and close the back there, just to get the movements. The main key really is to keep the movement within the spine there. Obviously, it's difficult to know what's obviously causing this, obviously without the assessment. And as it's already been sort of pre-said, that obviously we are here for to do an online sort of assessment and see what's going on and get some information as to when this happened, why it happened, and so forth. But of course, the body is actually designed to keep moving. So most people make the wrong thing of stopping moving and being more sedentary, when in actual fact, you need to be moving the body much more. That's what the body is designed to do. But with all these stretches and everything, just make sure it's within the comfort zone, don't over push. And yeah, and basically I'm here just to, if you need to give a call or whatever, and hope I can give more advice. And hopefully see you when the clinic's back open again.
Yeah, thank you. Much like Philippa's final point there, it was around pacing yourself and not doing too much. I think from our point of view, as Kate was kind of saying, was that if the problem is if you do too much, then there aren't people there to pick up the pieces or to see you face to face. So what we want to try and do is give you little snippets of, it is important to do movement. It is important to get out and exercise, but you don't need to push it too far. Just do it all within your comfort zones. And we're definitely here to guide you along the way. And there were some great exercises there. So thank you, Kate. That was great. Right then, let's have a look at another question that's come in. This is from someone in Northampton, actually, or Northamptonshire, if I'm going to be accurate. I had a fall in January on my side. My neck and top of the shoulder have been painful ever since. I had a shoulder scan and was told arthritis, but don't feel that the scan was of where the pain is coming from. Can you please advise? So as it's in your patch, Sophia is our chiropractor in Wellingborough, Northamptonshire. Yeah, I'll put that to you if that's okay, Sophia.
I'm so sorry to hear that you've had a fall. It's a bit of a tricky one because obviously I don't know sort of the details of how you fell and how you landed and things like that. And it can be frustrating sometimes when you feel that maybe your pain is in one place, but maybe not where this scan or this diagnosis that you've received has given you a diagnosis that maybe you don't think is accurate. Sometimes when you have a scan or a test for something, then it will come up with what we might call an incidental finding. So they may well have found that there's some arthritis in your shoulder that might have been there before, and maybe you weren't experiencing any symptoms in that shoulder beforehand. But sometimes a fall or an injury can accelerate symptoms that weren't there before or highlight them. With regard to your neck, it's a bit of an area where sometimes if you've got some dysfunction or you've hurt your neck or some of the soft tissue in that area, then you know you might get symptoms in one or the other of those areas, but they're so close that you don't know if the pain here is coming from the neck and vice versa. Whilst we're at home, we're stuck at home, like we've said already, we're always on the phone, so we can do assessment by a video consultation where we can look at your range of movement, how your neck's moving in certain directions, as well as how your shoulder's moving, if it can move up and down, if there's any restriction in there, and if any of those movements cause you some pain or discomfort, which will help to give me an idea of what's going on. We'll be able to also take a lot more information from you about other symptoms that you might have, so if there's any other pins and needles or tingling or anything like that elsewhere. And then mostly give you some advice about the kinds of things that you can do. But for now, like Kate said, the best thing really is movement. So I always say to my patients, movement is medicine. So even though you're in pain, don't feel or feel the need to hold yourself still. So try to keep everything moving. And so we can just keep this whole area moving. So head, keep it moving, side to side, looking around behind you, ear down to shoulder. You can see I haven't got much movement in that direction, and chin to chest like this. And as well, keeping your shoulders moving, so rotating your shoulders round, back and forward, trying to bring it up to the side, just within the range that you can without pain. So if pain kicks in at this level, that's where you stop, and you just keep moving it at that, in that range. But we can and then, you know, add to that and give you some exercises, some videos of specific exercises you can do. Another thing that will help, another you might find, is when you wake up in the morning and you've been still all night, or if you've been lying on your side, everything's always a little bit more stiff in the morning. So getting moving is really important, as well as you might find when you've had a shower or a bath, or if you apply some heat, like a hot water bottle or a heat bag, then that will loosen up and soften all the muscles and just help with that pain management. So I hope you can, you know, the pain isn't too bad. If it is and you want to have a conversation, then get in touch. But if not, then just keep moving.
Great, yeah, thank you very much. I like that, movement is medicine. I think that's a good term. I heard another description of it is saying motion is lotion. Yeah. And it is key. And I think very, very rarely do we as chiropractors tell people not to move. I think it's quite an outdated historical advice that, you know, many years ago people would be told to stop moving and rest. And ultimately, there are times that you need to rest, especially, you know, post-injury, acute injury for a certain amount of time. But our job really is to get people moving and back into their optimum health as quickly as possible. So yeah, I think more often than not, we try and restore function to areas where we can, so that people can move more, and then ultimately through moving more, you rehab the area to its best ability, really. Okay, let's have another question. And I fear that I haven't answered one yet, so it might be on to me. So this next one says, I noticed you say you can help with dizziness. When can I come and see you, and how can you tell what is going on? That's a very good question. And if I'm perfectly honest, it's somewhat difficult to assess dizziness completely remotely. So there would need to be some physical assessment involved in that. When you would come and see me, the ultimate aim from my perspective is to work out whether it's as a result of something that is going on centrally within your system. So whether it's something that's coming on from within your brain, or if it's something that is just the messages coming from your ears, which sometimes happens. And sometimes it's also worth trying to work out what you mean by dizziness as well, because dizziness explained by one person is going to be different to that explained by another. So sometimes people that have just balance issues would describe it as dizziness, and then another person would describe dizziness as swaying and falling into a wall when they're walking along, or some people it's for when they're turning in bed and they suddenly get this kind of feeling that they're in a washing machine. That last feeling is actually quite common. It's something called BPPV, which is short for benign paroxysmal positional vertigo. It's a form of vertigo, and it's just to do with the fluid in our ears. If you didn't know, the fluid in our ears is responsible for feeding information with regards to where our head is in space into our brain. And sometimes it just gives mixed messages to the brain when that fluid isn't moving as freely as it should do. And actually, it's something that is fairly straightforward for us to resolve, usually within a couple of treatments. But the important thing is that we can actually assess you first. I have got here actually that we have these snazzy little goggles that you put on, and what that gives us is the ability to look at your eyes, and it shuts off all the light so that I can actually look at your eyes and see how they're moving, and examine those when you're looking right, when you're looking left, and put them under a little bit of stress, especially with movements that might bring on some of your dizziness. So if that's something that you're interested in when we're back up and running, you're very welcome to book in with me, and I will take a look at all of the symptoms that you're experiencing with your dizziness. But yeah, that last one that I was talking about, BPPV, is very common when you're turning in bed, or you suddenly get up from lying down to sitting. But also sometimes just getting up from lying down to sitting, or sitting to standing, it can give you a big change in blood pressure as well. And that too, as you stand up and you maybe get a change in blood pressure, that too can give you some dizziness. So yeah, key here is it is important to get it checked. If you haven't already seen someone about it, you could give us a call, you can speak to your GP about it, but definitely welcome to come and see me, and I will assess you fully when we're back up and running. Okay, let's move on to another question, if that's okay. We'll go back through the cycle. I'll try and pick ones that are relevant to the right person. So Tamsin, although she does see everyone, you know, there's no one that she won't assess, but she does have a very specific interest, thank you, a very specific interest in pregnancy, and supporting people through their pregnancy. So this next question says, I am 7 months pregnant, and in the past 2 weeks I've started to get numbness and tingling through both hands and wrists. The only thing that seems to ease this is hanging them over the side of the bed. Is this related to my pregnancy?
Yes, it can be. You can get carpal tunnel syndrome, which is what it sounds like in non-pregnant people, but sadly, once again, a lot of pregnant women do suffer from it. It's not actually known what makes it so common during pregnancy, but it's thought to be hormone related. So what is it? Well, the carpal tunnel is a little passage made of small bones and a strong band of tissue in your wrist, and tendons, blood and nerves run through this little passage, and the nerves control the sensation and movement in our hands and fingers. And of course, during pregnancy, the body retains more fluid, which often causes swelling, just like we suffer with ankle and hand swelling. This can happen in the wrist as well. The body retains more fluid, which causes swelling, and hence carpal tunnel can be a result of that. Symptoms are typically how you've described, really. They can be as small as just numbness and tingling like pins and needles in the hands and wrists, which might worsen at night, and it can range up to throbbing sensations, really, swollen fingers, difficulty gripping things, and fine motor skills like doing a button up or doing a clasp on a necklace. So what can you do to help yourself? Well, you could use a splint. I think I've got one, just hang on, let's have a look. There's one here. You could use a splint to put on your wrist like this. It's just to keep your wrist in a neutral position, especially when symptoms tend to be worse at night. You might put it on, it might be more beneficial. If it's practical, of course, wear it during the day as well. Reduce the activities that is causing your pain. So if you are on a computer a lot without a wrist support and you're doing repetitive actions, then have lots of breaks. Get a wrist support on the keyboard to help stabilize and support your wrist, and try not to do too much for too long. Try and rest it when you can. You can rest it on a pillow when you can. Because it's an inflammatory thing, you could try putting a little bit of ice wrapped in a handkerchief onto this area of your hand for 10 minutes or so. You could soak your wrist in cold water if you wanted to for a minute, just to try to reduce the inflammation down. If it's aggravating you more at night, it might be that you avoid sleeping on that affected side to try to relieve the symptoms. You could try lying on the other side and elevating your hand on a pillow while you're sleeping, just to keep your hand in a more comfortable position, and of course wearing that splint. And after rest, maybe some exercises would help. Things like stretching your hand open and then closed and open and closed. You could take your wrist into a ball and you could push up against the other hand and relax. You could turn your wrist over and push up into the other hand and relax, and then you could turn with your thumb upmost and press up into your hand and relax. Also having your hand open and then bringing your thumb across and then opening your fingers and straightening and relax. All of these are, like we've discussed, getting movement into your hand, because we know that keeping still doesn't help, and just relieving some of the pressure off of the area that's causing the symptoms. And like we've all said, then when we're up and running, we can see you to be more specific as to what's causing your pain. But it very much sounds like carpal tunnel syndrome. Does that help at all, Dan?
Yeah, I think that's fantastic. Thank you ever so much. Just whilst you're on here, so you're based in Abingdon and Newbury, but we were talking about your specialism in pregnancy. Obviously, in your room, you've got some adaptations that you make for pregnant patients. What specifically do you do when they're with you?
Oh, well, shall I show you? I've got a great, hang on, let me see if I can turn my camera round. I've got a great pillow, which I use, I don't know if you can see this. It's a great pillow that lies on the bench, and it allows for my pregnant mums. Let me see if I can get you. Yeah, so that's called a Balloose pillow, and it's really great for the pregnant mums because it has a big space for their bump, which can be altered, widened, made bigger or smaller, and for their boobs. And it's just really comfortable. It makes it possible to treat them lying on their tummy, which is really helpful. It's comfortable for them, and it's a great plus to the clinic. I take it to Newbury with me, and I have it here in Abingdon as well.
Great, thank you ever so much. Right, let's move on to another question. So Charlie, this is back round to you, because this is actually an animal question. So it's not about humans, it's about animals. So my 9-year-old Labrador has just started to struggle getting into the car. It doesn't seem to be an issue with all his legs, but his back left leg does appear more stiff generally when we're on walks. Is there something you would recommend I give him or do?
So yes, there's a few things that you can do. Firstly, saying about difficulty getting in and out the car, what I would advise is actually buying a ramp for the car so the dog's not jumping in and out to reduce the impact on their joints. And also, what we tend to do, obviously, as caring owners, is if we see a dog struggling, is to then naturally lift them in the car, and it actually prevents injury ourselves from lifting a dog in and out the car. So there's plenty of different varieties of ramp, and most of them fold up quite neatly and fit in the back of your car. And you know, it'd be better as the dog gets older for it to be able to walk in rather than jump in and out. He said the stiffness is occurring during and around exercise, so it might be an idea just to reduce walks for a week or so, or keep them on the lead. And if you know, if they ball throw, or if there's anything too vigorous, just keep them a bit quieter for a couple of weeks just to let things settle down. Being a slightly older dog, there may be some age-related joint changes going on through the pelvis. So I do often recommend supplements to dogs. I give a couple to my own. I tend to recommend You Move, which can be bought in either tablet form or like a dog chewy form, depending what your dog prefers. Vets do recommend this as well. But also I give Golden Paste as well to my dog, which is a combination of turmeric, coconut oil, apple cider vinegar, all things just to help with a little bit of mobility in the joints. Ideally, swimming is an incredible thing for dogs, especially older dogs, to help with mobility. We don't have access to hydro pools or centres at the minute. If there's an opportunity to safely take your dog swimming somewhere, maybe a lake or somewhere near you, just to get, you know, even if it's a minute a day, just a little bit of motion in the back end, that will really help. You can do some light massage at home as well. This will really help loosen some of their muscles. What I tend to recommend is just taking your thumbs and gently kneading in circles around their back end and sort of into their leg muscles as well, and some gentle friction exercises as well. This just helps stimulate the circulation to their joints. You know, keep it gentle. It's a very sensitive area for them. Just very, very light movements, circular movements is absolutely fine. If your dog's a little anxious about that, because they sometimes think, you know, what are you doing? You can actually just brush their back end as well, which is quite soothing, but it also keeps the circulation going. And finally, I'd say, you know, make sure they've got a cushioned area to sleep. You can get a memory foam bed for dogs. Some of them like it, some of them don't. But just make sure that, you know, certainly at night, that they've got a comfortable bed to sleep in, where actually they've got room to stretch out as well, just to help them become more comfortable. Yeah.
Great. Yeah, thank you very much. And I can vouch for Charlie's expertise when it comes to animals, because my 10-year-old dog got adjusted just before lockdown and doing remarkably well after that. So yeah, thank you ever so much for keeping him going. Okay, right, let's have a look at another question, steaming through them. So I'm 62 and a keen runner. I've never had any aches and pains, but probably been pushing it a little more than I should recently with lockdown. That goes back to our boom or bust conversation earlier, I guess. Now my right knee is aching when I run. Should I give up my running? Let's put this to Philippa in Bournemouth, if that's all right.
Great. Okay. So it's quite common if you start to overdo things a little bit to get some increased aches and pains. So it wouldn't be something that I would immediately think to stop running, just some ache. If it was a bit more than that, you might want to take a break. But if you're comfortable still running through it, it's probably best just to ease off and go back to your previous intensity or duration of running, and maybe a little bit less until you've got something more comfortable for a while, I'd say. There's some things that you can do at home to help with the stabilizing of the knee joint, helping with those muscles, and using the NHS site for runners. Runners and knee pain can be helpful, but obviously if I was able to speak to you, I'd get some more clarity, and if I was able to assess you, I'd get even more. So there's other things that you can do apart from the stretches and exercises. Think about your shoes. So if you've not changed them for a while, so they've kind of done their mileage, then it might be worth doing some research to get the correct running shoe for you. Other aspects, probably what you're running on. So if you're doing a lot of road running, if you're able to run on grass, that's probably better. A beach, if you're in Bournemouth, that's even better, although darn hard work. Doing some self-massage, so you might find that you've got some tender spots in the muscles above or below the knee, and using your finger, actually much like the dog massage, you can use your thumb to get in there and just help those muscles out, because it's typically helping those muscles relax back down, because you've probably got some tightness in there after just pushing over. And we're all overdoing it slightly, or underdoing it. In some ways with this lockdown, it's a tough time, and we're making the most of it. But probably some cross training. So if you are reducing in your running, you might getting some cycling or some walking, and some yoga for runners specifically could help with some stabilizing of the muscles in the legs for you, and that would be some good self-help advice for the time being, and any more support we'd be happy to provide. Thank you.
Yeah, fantastic, thank you. Yeah, I think with knees, you've hit the nail on the head to some extent, because a lot of knee problems that we see aren't actually as a result of the knee itself. It's some of those muscles around it. So all of that advice with regards to some of the stretching and the massage, and just tailing it back a little bit with your running is spot on. So yeah, thank you very much. I think that would go the same for any exercise, really. If you suddenly start to develop aches and pains during your sport or your activity, just tail it back to a point where you didn't get those aches and pains. So if you're getting it with a 30-minute run, but you weren't getting it with a 20-minute run, we'll start to incorporate some of these warm-ups, exercises, some massage. Obviously, come and see us when we can help you, and do a 20-minute run, and just start to build it up, and make sure that as you add on your time or your distance, that it is pain-free and comfortable. So yeah, thank you ever so much, Philippa. Okay, let's see another question. So this would be interesting. I've had a stroke last year, and ever since have general weakness down the left side of my body. I'm 76 and not sure I can be bothered doing the sheet of exercises I was given at the time. Will my strength come back by itself eventually? Kate, if I can put this to you. So Kate's our chiropractor in Farringdon. She also works out of Wantage as well. But yeah, Kate, if you don't mind answering that one.
Okay, so basically what it sounds like is that the stroke has affected the right side of your brain. A particular part is what we call the motor cortex. And this causes weakness within the muscles, because it controls the muscle function there. And because it's been affected, obviously the muscles aren't getting the correct signals. Now, although the main weakness is occurring on the left side, the right side will also have mild weakness compared to normal individuals. And this is because that the nerves coming out of the brain at that point, which control the muscles, have also been slightly affected as well. So basically, when the function of this part of the brain has been reduced, it contributes to the muscle weakness and atrophy, which is basically just reduced muscle mass. So with decreased activity, this is going to be increasing this and decreasing the muscle mass, and obviously increasing the muscle weakness because you're not using them. Exercises are great to do, so I highly recommend that you do the exercises. because what this does is it increases the muscle strength. It can also encourage the neural pathways in the brain to sort of do some adaptation so that you can then, the function of the limbs start to improve much more, which is great. And basically that will then also stop muscle wastage from continuing, because the strengthening will obviously help that. You've also got to be aware that with the reduction of movement on one side, it can increase the chances of osteoporosis. And by doing the muscle strengthening and the exercises and training, this can obviously, but it's involved with the bones and everything as well, this can obviously decrease the chances of you getting that. So yeah, definitely keep doing the exercises. It's the best thing to do. It'll encourage the brain to keep working there a little bit more, make sure that you don't lose any more muscle mass, and that you start to strengthen up that side of the body much more.
Great, yeah, thank you very much. I thought there was some fantastic points in there actually, and just to further that a little bit, so Kate was touching on this element with regards to using different areas of your brain for movement, essentially. And I won't go into lots of detail, but there's something called plasticity, which basically means your brain can adapt to take on functions that it's lost. But the way the brain works, it takes at least, and this is bottom end, it takes at least 3 to 5 months for those changes to take place, and for them to get laid down as foundations within your brain. So we fully appreciate that sometimes when you get given these exercises, especially if it's just on a sheet of paper, it doesn't feel very individual to you. But you get given these exercises and you do them for a week, and maybe you just feel like you're not getting anywhere. But this is a fairly serious thing that has happened to you, as Kate was explaining. And you just have to appreciate that those exercises, for them to actually make those changes within your brain, you're going to have to do them for at least 3 to 5 months, and then beyond, to actually start building up some of that muscle mass again, that Kate was just explaining. So yeah, that's a very interesting question, and it's difficult, isn't it, Kate, to actually be able to be specific with regards to someone's case, but I think generally you've covered all bases there, so thank you for that. Let's move on to another question. So this one will be for Sophia, I think. My husband is 43 and has had back pain for as long as I can remember, and we've been married 22 years. Congratulations. But recently he started getting pain down the back of his right leg and into the foot. Is this something completely different?
Okay. Sounds like from what you've described, that sounds like your husband has got what's commonly known as sciatica, or symptoms that are similar to that. So sciatica is a word or a term that is used to describe when something is irritating your sciatic nerve, which exits out of your lower back and it runs all the way down the back of your leg and into your feet and toes. And the most common cause of something irritating that nerve is where one of the spongy discs from in between your vertebrae and your spine pushes out and presses on that nerve root. But it can be a number of other things, and sometimes we haven't got anything as frightening as that, but you still sometimes get those similar sorts of symptoms. So it could be a tight muscle, it could be other things as well. However, nonetheless, the symptoms are still there. Something is causing that sciatic nerve to talk to you with these symptoms of either pins and needles, tingling, pain, sharp shooting pains. They're the most common symptoms. So the best thing to do would be to, and especially also since you said that your husband has a long history of back pain, it sounds like maybe the most common cause could be that he's got maybe a disc that's sort of bulging out from his lower back. Regardless of what it is and what the cause is, some exercise is going to help with the symptoms. So some stretching exercises where you're, it's almost similar to if you were to stretch hamstrings in your calves and the back of your leg. So stretching over with your legs out straight and almost sort of slumping forward is going to help to stretch out those muscles, because when that nerve is being all irritated and angry, all the muscles around there will all be trying to protect it, and so then they will equally be adding to the whole sort of story. So stretching your legs will help to take away that muscle tightness, as well as putting that whole nerve under tension to try and relieve some of that irritation. Trying to keep your spine mobile and nice and level and aligned. So again, simple exercises like lying on your back and hugging your knee towards you. I think someone's mentioned that one before. Or the cat-cow exercise when you're on your hands and knees. So all of that will keep your spine moving nicely to allow everything to function at its best and to hopefully relieve some of that restriction that might be causing that irritation of your nerve. Like I said, it might not be that, and I wouldn't dream of diagnosing anything without seeing somebody, but those simple exercises that we could put up are definitely worth a try whilst you're not able to sort of seek any treatment at the minute. Obviously, you can always look on the NHS website. They've got links to some exercises that you can do. They will, suggest other things that you can do, such as call your GP, over-the-counter medication from the pharmacy if your pain isn't manageable, or if it's stopping you from sleeping or not managing to do what you need to do every day. Then obviously you'd perhaps have to speak to your GP, or give us a call and we can talk it through in more detail and in person over the phone. So I hope that's helpful.
Yeah, great. Thank you ever so much. Yeah, much like Kate's previous question as well, with the ultimate aim of just restoring some of that movement. I think you mentioned it there as well. We're very good at moving our hips maybe, and going for a walk every day, but we don't necessarily apply motion to our spines as much as we should. With regards to disc problems, as you touched on it there, probably a lot of people don't appreciate that 60, 65, 70% of people over a certain age group actually have disc bulges in their lumbar spine, and you just don't know about them. So it isn't something to necessarily worry about. It's just that when it gives you a little bit of nerve irritation, that's when you start to know about it. And we see people with disc problems day in, day out, and these are the things that we deal with. But ultimately, these exercises are hopefully going to get you through this time at the moment when you can't move, can't get to see someone face to face. But I'm pretty sure we'll be back up and running very soon, and being able to help you with all of these problems that you've already mentioned. So yeah, thank you ever so much for that, Sophia. Okay, so a question next is, I've been experiencing migraines for 10 years and tried every medication under the sun. Is this something you could help with? I'll take that one if that's okay. 10 years is a long time to be experiencing migraines, so I completely sympathize with you on that one. That's not a nice thing to have been going through. It does sound like you've been under the GP already, so you've already had some form of investigation on the basis that you said you've taken every medication under the sun. So I'm going to make that assumption. But migraines and headaches are things that we routinely see through clinics. Chiropractic has been shown to be very good at preventing both of those. So preventing migraines, and great with any headaches that come from referrals through the neck tension, etc., and muscle tensions into the head. We have quite a good success rate actually with reducing headaches and preventing migraines, and especially feeding into any neck related symptoms. I think at the moment, I would say more than ever, whilst we're working from home, what you probably find, I don't know your own circumstances, and I don't know if you are working at a desk from home, but what we find very often is in the workplace, maybe our desks are set up to deal with our positions. Oops, sorry, so what we find in the workplace is that our desks are suitably set up for our environment and how we should be working. When we're having to work at home and we're maybe sat at the dining room table, or we're doing our work now sat on the sofa watching Netflix, then the position that we're in isn't as suitable as it should be. So you might find that you've got more anterior rotation or forward rotation of the shoulders, so hunching of the upper back, and also you might find sometimes that you strain and carry your head too far forwards. I think further down our Facebook page there is a discussion about linking the weight of a pumpkin to the weight of our head, and it just shows, also they're the same, just in case you didn't know, and every time that you take your head forwards, it puts a massive amount of strain through your neck. So first thing that I would say is, just at the moment, whilst you're working from home, try and make sure that you do get up, you take frequent exercises every 15 to 20 minutes, or at least half an hour anyway. Make sure that you go, make a cup of tea, have a little bit of a walk, and just doing gentle exercises. With regards to neck exercises, what I would say is people are very good at doing side-to-side exercises and do up and down. But the one that they forget to do is sometimes the side bending, so ears to the shoulders. I'm just watching everyone in the videos doing their side bending as well. And it just gets some of those muscles at the side of the neck a little bit better. And these are the ones that feed up into the occiput, which is the base of the skull, and can give you some of that tension and increased likelihood of migraines as well. Make sure that you do get out every day and get some good air into your lungs, get some oxygen around your system as well. And then just this last exercise that I was just saying with side bending, what you can also do is when you side bend is just move your nose out slightly as well, as if you're trying to sniff the air. So take it to the side and just sniff the air slightly, and then same to the other side. And it just gets a little bit of a different group of muscles. But again, as we've said previously, if you want an online consultation, then I'm here for you, as we all are, and we can talk through some of the reasons why you might be experiencing that, completely complimentary. But if you do need us in the future and do need a face-to-face appointment, then yeah, chiropractic has been very effective in preventing migraines and working with those neck-related cervicogenic headaches. Okay, so that's the end of the questions. I think I haven't seen any others. So I think we've covered everything, right from animals through to neurological disorders and our general aches and pains that we see day in, day out through our clinics. So I'll say a thank you on behalf of everyone. I'll get everyone to wave goodbye. But yeah, thanks ever so much for listening, and hopefully we'll do this again soon.